Dr. Shanklin with Smart Plastic Surgery.
I feel like falling in love. I'm in the mood to fuck something up. Better fucking something. I need some drink in my cup. Hey, I'm in the mood to fuck something.
All right, cousins, welcome back to my channel. If you are new here, go ahead and press the thumbs up. We're going to go ahead and jump right into this video. Go ahead and press that subscribe button. Today we're going to go ahead and do a live reaction video on Dr. Shanklin. Just to give you a recap, Dr. Shanklin originally just recently transferred within the last, I'll say 30 days. I'll give him 30 days. He left Vixen. So if y'all looking for him, he's over at Smart. Okay, he's over at Smart. This is his real Instagram page because we have been having people that's been trying to scam Dr. Shanklin and create falsification pages. But Dr. Shanklin is over here at Smart. It's literally not even 15 minutes from the airport. I stayed at the Hilton last week, and I was literally 8 minutes from Dr. Shanklin because my best friend had Lipo 360 over there with Dr. Shanklin. Okay, so we're going to go ahead and get on into Dr. Shanklin. He over here doing the thing. FYI, he is running a special. He's running a special. It says Be Smart Easter Special HD Liposuction starting at $3,000 and surprise package. I'm not for sure what the surprise package is, but the small print is saying new patients only. Let me see, pre-op and post-op packages up to 50% off with this promotion. So I'm not for sure if that's maybe like including 50% off on a faja, 50% off on a massage, yeah, 50% off on, you know, pre-op supplies. So, but it does says new patients only. All right, so we're just going to go ahead and jump right on in. Dr. Shanklin, he's known to be the combo king. He's known to be the combo king. So far, his wife, this is his wife. She's his partner as well, and she seemed, for the most part, I follow her on Instagram, she seemed very genuine, very supportive in what he does. A lot of the cousins been reaching out saying their encounters with her has been very genuine. She's very knowledgeable in this field and everything. So we're just going to go ahead and do a quick little breakdown introduction with Dr. Shanklin and his wife, so y'all can get a feel of their personality. Oh. All right.
Boss, my wife Emily. She and I worked together for 14 years. So Emily's a certified surgical first assistant. She has worked in plastic surgery with me for 14, 15 years. So she's a big part of my team and part of what is now Smart Plastic Surgery Clinic here in Miami.
It's not only rewarding for us, but to see the patient happy, to see them thrilled to have their body back, to that boost of confidence that they get post-surgery, and it's such a wonderful feeling to see them.
You know, people ask of, you know, don't you get bored with your job? No. We do the same thing, you know, day after day after day, but it's a different patient. It's a different person. She's gone through different things in her life. She may have different goals, whether it's to get the body back that they had before kids, or say, as an example, a bariatric patient,
Weight gain.
you know, where they've lost a tremendous amount of weight. It's to get the body back, or get the body they never had, that they've always wanted. Come see us here at Smart Plastic Surgery Clinic in Miami.
All right, how do y'all feel about that? So I feel, for the most part, I feel like this is very genuine and sweet. You know, just giving like a backlog and general experience on Dr. Shanklin, and from what I've been hearing from cousins that's been going over here having surgeries with him. We're going to go ahead and jump over into another live video. Let's see. We're going to go ahead and jump into this live video that I actually missed, so we can do a reaction on it. On this live video, I was able to watch it just a tad bit. I kind of skimmed through it a little bit, but for the most part, he is answering, and they are asking a lot of questions that's never really like been answered before. And a lot of the questions you guys are actually asking me. So I feel like this is something that we all need to know. It's good to know that with Dr. Shanklin, he said now he's setting a standard bar high where he will be trying to meet with his patients, especially if they're staying out there 5 to 7 days. He'll try to meet with you guys, if not the first post-op appointment, but the second one. He is saying that with most of his patients with the tummy tuck, you guys are going to be getting at least 2 drains. He said in some, depending on the patient, sometimes they have to get 3, but in most cases, it's been 2 drains. Also, Dr. Shanklin is saying as well as, like I said, they saying that he is basically the king. He's the combo king. So he's basically saying like he does different types of procedures, combo procedures, combinations. If you want BBL, Lipo 360, breast augmentation, or if you want breast reduction with tummy tuck, extended tummy tuck, he's the man. So, I mean, Dr. Shanklin, from the most part, he's been putting it down. He's building back up his rapport on his page, because you know that they did take down all of Dr. Shanklin's work that he did have on Vixen's page. And for the newbies that's interested in him, some of them was kind of like, you know, kind of discouraged because they really couldn't see Dr. Shanklin's work. Okay, so he is building back up his platform. For us OGs that been known of Dr. Shanklin, and that's sticking beside him and still booking with him and referring people to him, we already know of his work and what we've seen on Vixen platform that represented for Shanklin. So for the most part, now he's just building back up his platform on his own page. So we're going to jump right on in. I really appreciate him for doing this video. Like I said, y'all, come on in, press the thumbs up. Let's go ahead and jump right in. Don't forget, I will have to stop in between just to collab with you guys a little bit, because with YouTube and you doing a live reaction, they do want you to, you know, engage a little bit. So let's go ahead and get started. Okay.
Okay, so hi, Dr. Shanklin.
Hello.
We are live.
Hi, everyone.
We're live right now. Thank you for being here. And we already collect some of the questions that our followers post, so we can start with those. So I have here, how many liters of fat will be removed during my procedure?
So for liposuction alone, and this is based on the Florida state law, the amount of lipoaspirate that we can remove is 4 liters. And that would be for patients just getting like a Lipo 360 or Lipo 360 and a BBL. Now, if we're doing a combo procedure, say liposuction and a tummy tuck, we're limited to 1 liter. So for some patients, that may be where we have to discuss what all we can do, or localizing areas in regards to what we're going to do for the liposuction. For a lot of patients with a tummy tuck or an extended tummy tuck, we may be doing, say, the flank. So the flank liposuction, kind of going further around the waist towards the back. With that is, I'll recommend that for a lot of patients that we're doing a tummy tuck or extended tummy tuck, because it also helps to loosen the tissue that we're trying to kind of rotate around to get a nice hourglass silhouette from that tummy tuck.
Awesome. And I have here, will Dr. Shanklin be using small tubes for a drain or no drain?
So patients that we're going to use a drain on are really just limited to tummy tuck patients. And so tummy tuck patients will be getting at least 2 drains. And in some cases, we may put 3 drains in, and it's really just kind of patient dependent. But definitely the tummy tuck patients, on rare occasion for breast, if we're doing a revision type procedure and we may have to go in and do a lot of work, such as on the capsule or removing implants or converting from like implants on top of the muscle to underneath, I may put a drain in, and that I'll kind of tell you the day of surgery depending on, you know, what we're talking about doing. But that's a rare occurrence for breast. For tummy tuck, it's always, you're going to get at least 2 drains.
Perfect. Thank you. And I have here, will he be doing the post-op follow-up personally after the procedure?
Yes. You'll see me at some point. May not be the first day post-op. You may see one of our post-op nurses, but you'll be certainly seeing me the first or second visit to see how you're doing, and then subsequent visits, especially if you're in town. If you've come in from out of town, I'm going to want to see you before you go home. So if you're getting on the plane, I'm going to want to see you to decide whether your drains need to come out. And in most cases, I'm going to be taking your drains out if they're ready to come out. But yes, you'll definitely be seeing me here post-op at Smart Plastic Surgery.
I have a question here from Amy Shimmer. She's saying, what is the best advice for preparing for a tummy tuck lipo combination procedure?
Oh, well, as long as you've met the BMI requirements, but certainly like any surgery is eat healthy, no smoking, try and be in good physical shape. And part of that is so you're going to be in good shape to tolerate the surgery, but also...
Okay, so you guys, so that's the thing. A lot of you, when I was there, a lot of cousins were getting canceled. They was getting canceled because they had nicotine in their system. They had nicotine in their system. So I say this to say, if you are a hardcore smoker, whether you smoke cigars, Black and Milds, cigarettes, or hookah, you want to stop 30 to 45 days prior to surgery, because they're going to do a nicotine test a day. Matter of fact, they're going to do it when you do your labs. They're going to do it at pre-op, and they're going to do it that morning of when you urinate. They're going to check for nicotine as well as they're going to check for pregnancy. So just FYI, make sure that you sway away from smoking or being around people that are doing nicotine, because if you're secondhand inhaling it and it's that strong and it's in your system, you will get canceled or you will get rescheduled.
To tolerate what's going to be in regards to post-op. Have your family prepared or loved one, significant other that's going to be taking care of you post-op. And we can go over a lot with them in terms of what the expectations would be for post-op. Also, a great thing to do is either the consult or, day before surgery when you're seeing us. If you have a list of questions, bring them. If you have specific, like for a BBL, if you have wish picks, bring them.
The realist is saying the golden heart. And we have another question here. It's, what is the required BMI? I know you told me, but I forgot. LOL.
So that depends on the procedure. And so patients, if they're just, say, Lipo 360 only, will go up to about a 40 BMI, 39 to 40. If we're doing Lipo BBL, usually the max for that is a 39. For the combo procedures, it's a 36.
Okay, so y'all hear that. So Dr. Shanklin raised his BMI. So he said if you're just getting a single surgery for a regular Lipo 360, you could be at a 40. If you're getting a BBL, Lipo 360, you can be at a 39. And if you're getting a combo Like Tummytuck and BBL Lipo 360, you can be at I think he said 36 or 37. Like that is real high. So Dr. Shanklin is really accommodating a lot of people with high BMIs. I didn't even know he went up to 40 for Lipo 360. But you guys, you do know the less your BMI, the better your results. So you won't have to worry about going to get another round for the same thing again. Just FYI. Y'all know how it go.
Thank you. And how many areas of liposuction are included in the 360? Is it 12 like standard or less?
It's standard. And essentially that's going to be the entire abdomen, upper and lower, going around the flanks and the back, and then, you know, up essentially towards the back part of the armpit, also going down to the area of the bonds.
Thank you. And where does he place the incisions?
For Lipo 360.
3 in the back.
I think so, yeah.
So those certainly look for if you've had any previous surgery. Like if you've had a previous lipo, I'm going to use all your old incisions. If you've, say, had a tummy tuck, you're coming back for some more lipo, I'm going to use the tummy tuck incision as much as I can, and at least on the front. And if you've had any scars on the back, if you've had old scars, I'm going to try and use those. Try and avoid essentially creating a lot of new scars if we can. If you've never had any surgery, you know, standard, you're going to get an incision in the belly button. You're going to get 2 incisions down kind of in the waist area. You'll get an incision laterally, kind of under the crease of the breast, on the back, behind the armpit, going towards the shoulder, and then the upper crease of the buttock, and then usually in the center of the back, kind of what would be underneath the bra strap. If you've never had surgery, and we're just trying to place our incisions where they're also going to be hidden post-op.
Thank you. And Jerry C here, she's asking, what's better, tummy tuck before BBL or BBL before tummy tuck?
Depends on the patient.
Yeah.
I need to see it or see pictures. And for some patients, yes, we can do them together. In some patients, I tell them you're going to get a great result if we do the BBL first, whereas others, you get a great result if we do your tummy tuck and then come back for a BBL. So that's
Okay, and he was talking so fast, y'all. So y'all did hear what Dr. Shanklin said. You can bring in wish pics. Now, with Dr. Cannon and when I went to Dr. Cannon last year, I asked the lady, could I bring wish pics? My coordinator, she told me no. So that's why I just told Dr. Cannon that I just wanted natural big. I didn't want big dramatic. So with Dr. Shanklin, okay, y'all, he's saying y'all can bring wish pics. Y'all better get them pictures together.
really dependent upon each patient, and that's why we encourage you to either do it in person, do a video consult, or send us pictures so we can evaluate and get back to you.
Thank you. And someone is asking, when should we start getting massages after Tummytuck BBL combo?
So for the combo, Tummytuck BBL is those patients recommend doing massage on the back. You can start the next day, and next day or the day after, at least start the ones that are going to be on the back. Now, for a tummy tuck, you can't have massage on the front because we've got drains in. I don't want to increase fluid. Once you get your drains out, and then usually a week after that, making sure that you haven't had any more fluid collection, then you can start the massages on the front. Mm-hmm. But it's important to start the massages on the back. And
remember, I told y'all that on that last video with Zoe, don't have them people massaging you and all that stuff, and you just had a tummy tuck, muscle repair, and all of that in the front area. They're not supposed to do that the same day or the next day. So y'all heard it from the GOAT.
Really going down to the area that we've done the BBL on, at least starting the next day or the day after that.
So Phoebe's Boo asking, for people that don't live in Miami, how are the follow-up?
Certainly in regards to the whole time you're here, we want to see you and then communicate either by phone, by video conference, or sending pictures. And then I've certainly followed up a lot of the patients post-op by phone, and if there's any issues, usually communicating just by sending photographs or video of any problems. And I encourage patients to send, even pictures 3-6 months post-op of their results or any issues, and results that they're happy with as well.
And Elmarie 191 says, "Yay! I'll be there to see you in 16 days."
Looking forward to seeing you.
And what is your BMI requirement specifically for combos?
So for combos, it's 36, and really that's combo that we're talking about,
he said 36 or
and with
37.
that would be for a tummy tuck. Now, if it's a combo like a Lipo BBL and breast aug, that will usually go up 38, 39. Same thing, it can be patient dependent upon also what the combination of combos that you want to have.
Thank you. For ladies traveling like myself, what is the time frame we must stay in the area? Does it vary per procedure?
It certainly does vary by procedure. Patients that are coming in, just say getting breast aug, then a lot of those we tend to do later in the week, and they'll stay in the weekend, or just 2 or 3 days. BBL is kind of the same thing if they're just getting the Lipo BBL. Patients that are getting combos, and especially combos that include a tummy tuck, 7 to 10 days. And the reason for that is I want to try and get your grains out before you are getting on a plane to fly back home. Combos where they're doing, say, breast, BBL, and tummy tuck, I'd really prefer you to stay about 10 days, and that's where we're making sure that everything is good, your drains are out, and you've not had any evidence of any further fluid collection in the abdomen. I know for some patients that is a big deal, but you're doing a big surgery and you're making a big commitment. So for that, trying to make sure that you get an ideal long-term result.
Awesome, thank you. And this is another asking for a friend. She's taking Adderall and has been for over 10 years. How soon prior to surgery must she stop the medication?
Minimum is 2 weeks and preferably 4 weeks, but that's a big issue with anesthesia. So I prefer they stop it for about 3 to 4 weeks.
Perfect. I see Dr. Shanklin does a lot of BBLs. Does Dr. Shanklin do arm lifts so we can see more pictures, then we can send them more pictures too?
Yes, I do, and partly the same thing is I need to see pictures of the arms and both frontal views and side views with it, because for a lot of patients, they may send picture or may want an arm lift, but they may need to have liposuction to debulk the fullness of their arms first, and then come back at about 6 months later for the actual lift. So for every patient, it's different. We see that in a lot of bariatric patients that have lost a tremendous amount of weight and have the ubiquitous.
Oh yeah, so you guys, so it come to my attention that Dr. Shanklin does deal with patients that have had weight loss surgery, as well as I'm hearing that he does deal with patients that have lupus. Everybody's case is different. So with the weight loss, that mean bariatric patients that didn't have the sleeve or the bypass. It just depends. I'm sure he's going to want your records and all of that or whatever, so he can do further. Well, so the nurse staff can look further over the labs and all of that and check your PTT and INR and thyroid and all of that or whatever. Make sure all of that is working properly. And make sure, verify what type of medications you are currently on. Make sure it won't interfere with the anesthesia. So that's good to know.
Bat wings, those are great candidates for an arm lift. But if they still have a lot of fullness in the arm, we've got to debulk it first. You can't do an arm lift on a patient that has real heavy arms.
Thank you. Someone asking, do you offer revision surgery for breast? This would be the third revision prior doctor messed it up twice.
Need to see them. And that's pictures, but what I also need is all your previous operative notes to know exactly what was done, what may have been put in, what type implant, if you had a mesh put in. So it's not just simply kind of coming to Miami and thinking, oh, we're going to fix it just like that. I need to know exactly what is there and what I may be running into in surgery to know exactly how to try and give you the ideal outcome, especially if you've had what you view as a less than ideal outcome before.
Mm-hmm. And someone asked, how many months must you wait between rounds?
For BBL, 4 to 6 months is the usual amount. And just, you want everything to be soft. You want, it's more importantly, if we're doing and you know, the areas that we're trying to collect fat from and liposuction from, you want those areas to be soft again, no swelling, no scarring. We want to get back to having good fat that we can then transfer.
Mm-hmm. Thank you. And someone asked, are there any specific surgeries that cannot be combined?
I don't like to do arm lift and breast surgery at the same time. The reason is that we're relying on the lymphatics in the armpit to do a lot of work to help heal it. So you don't want to overload those, and the problem would be more related to not getting an ideal result then from the arm lift if you're trying to do breast and arm at the same time. The other combinations would be a thigh lift combined with a tummy tuck or a thigh lift combined with a BBL. And it's kind of the same thing where you're putting a lot of work on the lymphatics in the groin to help heal things. And if they don't, you don't want a thigh lift incision to break down. So I'll always want to do those surgeries separately.
Mm-hmm. Mariali03, she's asking, what advice do you have for someone coming for a third round BBL, I guess?
Make sure you have enough fat for us to use.
As you can see, baby, Dr. Shanklin want to make sure. He want to make sure that y'all got enough jelly, baby, for him to transfer in that ass. Baby, have y'all been seeing his BBLs? Like, I never really paid attention to Dr. Shanklin BBLs. I always really was mainly looking at, like, his breasts, his tummy tucks, especially his Lipo 360s. That was my main thing, looking at his Lipo 360s of the dolls that were laying on the table and just looking at how he transformed them into a silhouette. That was my main thing, like just noticing that with his work. But baby, now, like, he been showing these before and after of some of these dolls that's been coming in. I guess it's like they second round, and maybe they first round they messed up, like sitting on their butt and they had a few flat spots, and he'll come back and he'll show how he transformed them. And baby, he didn't, baby, pop that flatness out, baby, and it is puffy, and I'm talking about just out there. I'm just like, oh my God, look at that BBL. Yes, Dr. Shanklin, baby. Silhouette.
Well, the other thing with that is also that third round, some patients come in for third round lipo BBL, and it may be that they've had pretty much as much fat as you can get from abdomen, flanks, back, going to the upper back, that I'll tell them that, okay, I need to use your arms or I need to use your thighs. And some patients aren't prepared for that. And a lot of it is just, you can kind of, for yourself, do the simple pinch test. You don't have much to pinch on the abdomen or even going around the flank. Look at your arm, look at your thighs. Some patients don't want, you know, those specific areas used, but if you're still trying to get an ideal outcome in regards to a BBL, we've got to get the fat transfer from somewhere.
Awesome, thank you. And
remember, y'all, I told y'all that's what happened to me, because I had a tummy tuck first, and then I went back for a BBL Lipo 360, and Dr. Kenneth basically told me I didn't have enough fat to transfer it from my abdominal area, and that's really where they like getting all that fat from. But he transferred enough fat from my sides and some from my back, but he said it wasn't going to be enough to just really give me that. So he ended up circling my leg, my thigh area. He was like, come here, let me see, turn around something. I was like, what you doing? He talking about, I think I'm going to go ahead and lipo your thighs. I say, you going to do what? I was not mentally prepared for that. Oh, my God. But, baby, let me tell you something. It wasn't as bad as I thought. It was like, probably like just a lot of pressure like on my thighs, but my thighs had healed very well. It was just one little incision. Like, I don't even know what incision is to this day. And I just made, have I made a year post-op yet? No. Wait a minute. I think I make a year post-op in May. Yeah, because I had my BBL last year in May. So I make a year post-op in May. This is April. So actually, next month, I make a year post-op from getting my BBL. Oh, my God. So, yeah, definitely, like, the thigh lipo, I don't know nothing about that arm lipo stuff. Baby, y'all got it when it comes to that arm lipo. I'm not dealing with it, thank God. Thank God. But if I had to get it, I'd just have to suck it up and go get it done. But, yes, I'm glad that he decided to go ahead and get it from my thighs. And we're good to go, period. I'm never, ever, 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 ever getting another BBL. Y'all, let me not say never, ever, ever, because, no, I'm not going back to get another BBL. Y'all got it.
Boo is asking, when does the drains come out? I guess for a tummy tuck.
Well, a lot of that is dependent on once we're at the volume of drainage. So for most patients, it's per drain if it's less than 25 cc's in a 24-hour period that can come out. Now, usually the earliest for that is somewhere between 5 and 7 days. Some patients can be longer. And that's also one of the reasons that I like to have patients staying here post-op for that period of time, because I'd like to be the one taking the drains out and seeing how they're doing, not relying on, you know, your primary care doc or another doctor in your hometown to remove them.
And MSMF being live, she's asking about the how it's the process to fix dog ears.
It depends on how big it is. And in some of those cases, if the patient has dog ear, we can just do it under local anesthesia. Or if they're having another cosmetic procedure done, we can do it at the same time.
Awesome. And
okay, y'all know what the dog ears are, right? So the dog ears are like at the end of the tummy tuck, on the both ends of the tummy tuck where it stopped. I don't know, for some reason a lot of girls be having the doggy ears. I don't know, like if their body is rejecting the incisions, or if they had caught an infection and it opened and it just, or it can be fluid pockets that filled up there that wasn't massaged properly. I don't know. It's a lot of different cases, but I have been prone to know that a lot of girls are getting the doggy ears. So that's good to know that Dr. Shanklin do offer a revision stage where he can do it under local anesthesia. So that means it wouldn't be as much pain. You wouldn't be under long. And basically he probably would cut it off and restitch it or whatever, and do a revision on it. So that's very good to know. Or if you're getting something else done, he can do it while he's doing whatever else it is you're getting. Like if you're getting your breast done or something, he can go ahead and do that part too. So that's really good to know. Okay.
for those who are prone to keloid scars, do you offer the steroid shots in the incision? I know it is not 100% that it will work to prevent keloids.
So you don't want to inject steroid at the time that you are doing an incision because it can actually interfere with the healing. Now, what I tell patients is starting usually about 10 to 14 days after surgery, as long as your incision is well healed and it has no drainage, is to get some silicone sheeting, which they can find just searching for on Amazon. And literally, if you just type in post-op surgical silicone sheeting, there's all sorts of different shapes and sizes. And I'll even, the morning of surgery, when I'm going through things with you or at the time of the consult, show you exactly what to get. That's the best thing to use once the incision is healed. The steroid injection has side effects, and it can actually cause the scar to thin and discolor. So I really avoid injecting that.
There is another question. Buddy Wignisha asked, do you do breast lift?
Yes.
Yeah.
And Godchild says, I love the haircut, Shank. And a heart.
Yeah. It was getting too long.
And then XOXO Disto is asking, so for Tummytuck, start the massages the next week?
Massage on, if you're talking about the abdomen, no, your drains have to be out.
Yeah, you have to
And
wait.
usually it would be a week after the drains are out before I tell patients to start massaging the abdomen.
Okay, I have here also, what is the most that can be taken out of during liposuction? What is the most that can be injected?
So under Florida law, the max amount of lipoaspirate that can be removed at the time of liposuction is 4 liters of lipoaspirate. In terms of the injection, so when we remove it, you allow what we term the lipoaspirate, which is the tumescent solution in the fat, as well as usually a little bit of blood from the process of liposuction. You allow that to settle, you remove the excess fluid, and then you inject the fat. So in most patients, if we're harvesting up to the max of 4 liters, you might get 1,000 cc's or 1,200 cc's that you can put in each buttock, and that tends to be.
Okay, so y'all see he's saying it's up to 4 liters. Also, just want to let y'all know, if y'all don't know, you can request your pathology and your medical records from Vixen or Smart. They're saying that it can take 30 to 60 days turnaround. That way you can actually see how much they actually took out of you as far as the fat for the lipo, as well as how much they inserted into you as far as like how many cc's you had inserted into each butt cheek. So that's, I feel like that's kind of good to know, so that way you'll be aware. And then if somebody ever asks you, or if you go back for a round 2, you can tell them, well, I already had this amount done, da 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 da. But just good for you to know for yourself, so that way you won't be curious and trying to figure out, oh my God, did they not take enough out? Did they not transfer enough? Did I not have enough fat? That way you'll already know, you'll have that on paperwork.
The higher amount, even with using a type of machine that helps us to not only harvest but also separate in a little better fashion. And most patients, the max that we can get out and put it into a buttock is about 1,200, but commonly it's somewhere 900 to 1,000 that we can get to use.
And I had Alejandra Amaro 86. She said, I had a combo lipo 360 BBL and breast augmentation with you 2 months, I guess 2 months ago. When can I sit on my butt and sleep normal on my bed?
You should be able to do that now.
So maybe you can do it now. And I have another question here. Is it local or general anesthesia?
So all of the procedures that we do under general anesthesia here at our center at Smart Plastic Surgery.
And what area are included in Lipo 360?
Oh, you already said
So they're
that.
talking about, so for 360, some people may say, do you do the 12 areas? So commonly, all that is included is the upper and lower abdomen, also the mons. In terms of going around, you're going to the flank and the back and up kind of to the shoulder, or just the area in the lower armpit is all the areas that are included in regards to what I do for Lipo 360. Now, some of that may be affected by our limit within the state of Florida in regards to the 4 liters. So we also have to try and plan that out in regards to what we're doing from the front to the back. In regards to some patients, if they tend to be on that higher BMI, we've got to plan out what we're going to remove, because we may hit the limit all from just the front of the abdomen. So a lot of that is really going to be governed by that number, but also trying to distribute it across the area that we're doing a Lipo 360. So that's why in some patients it may be, we'll tell them, okay, we're going to be able to get this done, but you may need to come back for a second round in 6 months. And same with some patients in regards to a BBL. Their desire for a BBL in terms of results and the wish pics that they bring in may not match their body. And
right.
So usually I'm going to tell them straight up at the time of consult that this is going to be first round, and we need to look at second round in, the earliest would be 6 months.
Mm-hmm.
Okay, thank you so much. And
that's what I like about Dr. Shanklin too. He keeps it real with a lot of the patients. A lot of cousins been reaching out to me saying that he told them that basically they may need a second round, or maybe a back lift or a thigh lift. And I would feel very, very what word I'm looking for? I would be, I don't know, I would be very like feeling like, oh my God, this doctor, he really knows his stuff. Like, he's really giving me the information that I need. He's really educating me on what's the next step after this, so I won't go home with high hopes and thinking that, oh, okay, 1 round does it. Some people can get away with 1 round, and some people really don't be needing 2 or 3 rounds. They just want this certain vixen look or this dramatic look and just really want to go for it all. And then it's some that really do need 2 and 3 rounds. You get what I'm saying? So it all depends. And then some cousins are coming from other doctors and they're getting a second round because they need a whole revision, or they just want it done all over, or they feel like the last doctor botched them. So it just all depends. But pretty much, I'm not going to push this video any longer. Pretty much, she was continuously like asking the same questions over and over. Some of the people on this live, I guess they was just joining, and they pretty much the main concern of the areas that they were concerning about was mainly like the combos and the tummy tucks and the lipo 360s or whatever. Just basically like how many areas is he transferring the fat, or how much is he externally taking out, and how many cc's he's inserting. So yeah, with that being said, like I said, do your research on whatever doctor you decide to choose. Like I said, Dr. Shanklin is no longer at Vixen. He's over at Smart Plastic Surgery. It's no more than 15 minutes from the airport, if that. It's a lot of hotels in that area, as well as Airbnbs. Like I say, they say he is the GOAT of the combos, and he called his dolls silhouettes. So like I said, big kudos and shout outs to Dr. Shanklin. I really love how he are interacting with his patients, as well as his wife engagements and stuff like that with the patients and stuff, especially with all of this transfer chaos that's going on, trying to transfer patients from Vixen over to Dr. Shanklin. So, I mean, for the most part, it's been a hassle, but I mean, I think they're getting through the rough patches. But I just wish everybody happy healing, everybody that's getting ready to have surgery coming up this week, this month. Happy healing to my April dolls, as well as the ones that just had their surgeries, getting ready to go to pre-op, or actually getting ready to fly back home. So, I mean, we all in this together. I want to thank you all so much for your support, for checking on me as well. Today I make 10 days post-op. Now I think tomorrow I will be going on my 6th massage. Like I said, I'm gonna get a total of 14 to 15, like Dr. Triggs said, well, that he recommended. I am wearing my ab board now. So yeah, I am starting to get a little bit of my strength back. I am standing up straight now, so I can't wait to start back going live with you guys. Just right now, I'm looking like how I'm feeling. I'm looking a mess, okay? Hair all over my head, but hey, it's okay. It's okay. It's okay. I'm in a recovery stage. I'm gonna get through it, and we're gonna stay strong together. Like I said, don't forget to thumbs up this video. Don't forget to thumbs up this video, and y'all just stay encouraged. And like I said, keep toxic people away from you, and keep people that's genuinely supporting you in your while you're going through your surgery journey. It's your cousin Krystal, and I'm out.
I feel like falling in love. I'm in the mood to fuck something up. Better fucking something. I need some drink in my cup.